Good morning, good morning. How is everybody so far? This is, if we could just get everybody to move, if you can, to the front. We're filling some of the gaps. We're family. We're about to have an amazing discussion about an issue that is foundational to our progress as people in this country. So my name is Rachel Noerdlinger, and for 3 decades, thank you, Albie. For 3 decades, I have had the honor of working alongside Reverend Al Sharpton and National Action Network and shaping the narratives and the images of what we have done. Sorry, this mic is miking. Okay, y'all can hear me, right? All right, so for 3 decades, we have been in the forefront of some of the most historic civil rights issues and items of our time. And you know, a lot of you know Reverend Sharpton and Nan for the work that we have done around police misconduct, or for the work that we've done around economics, or for the work that we've done around things like women's rights. But there's an area that National Action Network has been leading across the country, and that is around the issue of health equity. And you know, equity is like the new curse word in some places. But for us, equity is a very, very important reason why we are all here. Because you know, they say when America catches the cold, Black America catches pneumonia. Or when America catches the flu, Black America catches pneumonia. And so I have had the distinct honor as the co-founder of the Health Equity and Transplantation Coalition that I founded with my co-pilot, the globally renowned Al Sharpton. Together we founded the Health Equity and Transplantation Coalition. And we have been crisscrossing the country fighting for equality and for rights in a variety of areas in the healthcare space. And last year we had a historic win with Reverend Al Sharpton in that we were able to restore rights around a Medicare issue that was preventing people from getting access to blood transplant tests that can predict whether you were going to be rejected for an organ transplant. Now, Al Sharpton is the successful recipient of a liver transplant, and to my right is someone in New York that is a beloved leader for many, many years. He is currently a council member, Justin Brannan, is the recipient of a cornea transplant. And our chairwoman, our vice chair, Jennifer Jones-Austin, was the recipient of, she had one of the deadliest forms of leukemia. And she was the recipient of a blood transfusion and transplant from the umbilical cords of 2 little Black baby boys, saved our very own Jennifer Jones-Austin. And it was the work that Nan did to do bone marrow drives that helped Jennifer to get her transplant. And then finally, in a moment, we will be joined by the rapper Freeway. And he's from the streets of Philadelphia. But what he has received by way of a kidney was a new lease on life so that he could do work around equity for young people, and he's been really translating the word across the entertainment business as well. So while we're waiting for Freeway, and Jennifer, and before we allow our panel to tell a little bit of their story, I'm gonna just open up with a very brief video, if we could just cue that.
Dr. Martin Luther King Jr. once said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Our panel today represents voices who are committed to making a change. First, we have Al Sharpton, Executive Chairman of HEITC. Next, Jennifer Jones-Austin, Senior Advisor at HEITC. Justin Brannan, HEITC Advisor and NYC Council Member. And finally, hip-hop artist and activist Freeway. What ties these voices together? They've all received organ transplants, and now they're using their platforms to advocate for those facing similar struggles. fighting for equal access and dismantling barriers to transplantation. As we carry forward the spirit of Dr. King's mission, both NAN and HEITC are committed to continuing the fight for justice, especially in healthcare. Today, we're focusing on the impact of healthcare inequality in Black communities, particularly when it comes to organ transplantation. Together, we're raising awareness for this critical issue, demanding change for those who need it most.
So without further ado, I would like to introduce, again back to the stage, our founder and president and the senior advisor to our Health Equity Works, Reverend Al Sharpton, who will speak about the importance of health equity.
Let me say, as we start this panel, that health care is a civil rights issue. We must deal with the fact that the disparity in health care, when you look at what is available in communities of Blacks and people of color and other communities, are built in systemically. And Dr. King called the injustice in healthcare the greatest form of injustice. And access to healthcare is still in full need of us being at the barriers. So when I started talking around the question of healthcare, health equity, and was able to really see the scope of what this was, we said we had to deal with this and deal with it in a very high-profile way. When you look at the fact that Elon Musk and others are firing 10,000 health and human services employees, Robert F. Kennedy Jr. just fired people from HHS all over the country, as we have disproportionate problems in our community. We're number one in every health disparity that will take you out of here. And we need to deal with this as a civil rights issue. One of the things that I did not know a lot about was transplants. And when our friend and brother, superstar Al Shore, went through his turmoil and started in the midst of his pain and in the midst of not knowing whether he was going to make it, explaining to me the reason that we need to put energy around transplants. When we went through Jennifer Jones Austin's problems and we started the blood drive at the House of Justice. So this is personal. Al B is not just a superstar. He is a transplant patient that lived to tell the story. Jennifer Jones Austin is not just our policy queen. She's somebody that went through this. So as you hear this panel and our moving forward, it is driven by people that know if they did not have the means and access, they would not be here to be on this panel. So that is why I've partnered with them and partnered with Rachel Noerdlinger, who I partner with everything, but we definitely partner on this because this is extremely important. And I want everybody, a lot of people pick and choose at the convention which one they want to go to. Well, I'm going to this session, I'm going to that session. If you didn't have good health, you wouldn't make no session. So it is with that I wanted to bring on my friend, my brother. We know him for being at the top of the charts, and many of you know him from having a heartthrob from him in your day. But now he's trying to keep your heart beating, not your heart throbbing. The one and only Al B. Shore.
Peace and blessings, kings and queens. So good to see you. Can we hear it for our faithful leader, the civil rights icon, Reverend Dr. Al Sharpton? Let the church say amen. You know what this is. Oh my goodness. How do you follow Dr. Sharpton? Oh goodness. Whew. Okay, I'm done. First of all, I'm blessed to be here with this amazing panel who is family to me. I'm blessed to be home here in New York. You know, I'm from a place called where? Money earning. All right. I just want to make sure. I don't think most of you are old enough, so I just have to remind you. July 2022, I faced a medical crisis, a miraculous medical crisis, that is. Nonetheless, was faced with being on death's doorstep. I am celebrating from the standpoint that I am a successful transplant recipient. Okay, that's okay. I hear the term quite often, transplant survivor, things of that nature, but it's definitely, we're going to keep it in a positive space. Just to give you a quick description, I had what's called multi-system organ failure. That means all of my system shut down. There's one organ that you cannot operate by a machine, which is your liver. Every other organ, I'm going to give you a little education. Every other organ you can actually operate by a machine. If your heart stops, there's a heart machine. If your kidney stops, there's dialysis, you know. So I am truly blessed. I happen to be in Houston, Texas on a visit to a dear friend. You may know him by the name of DJ Eddie F. from Heavy D and the Boys, which we grew up together in Mount Vernon, doing demos, and started this record company called Uptown Records. You know, Jodeci, Mary J. Blige, Al B. Shore, Guy. You know, maybe some of the stuff you had some offspring too. Which leads to part of the encouragement of me finding the courage to conquer what I was going through, having those memories and things of that nature. I was also in a coma for almost 3 months. Septic, 60, Rachel, was it 60 to 70 blood transfusions? Rachel has all the notes. She talked to the doctor every day while I was in the hospital. Thank you. And to date, we're this year, I think, in August. I have 2 birthdays. My born birthday is June 4th, 19. My new birthday is August 25th. That's the date of the transplant. So, which was a 2-day process. So I have August 25th and 26th, which it took that long to do the procedure. But I am still here today to speak about it. I am crisscrossing the country with the Queen. Y'all know who that is. Miss Rachel Noerdlinger. We are in the halls of Congress quite frequently advocating for equal access to quality health care for you, for us. I was dumbfounded to understand, as I started to learn this process of healthcare, really just speaking backstage about how does anyone who doesn't have the means to take care of their health, how do they go through this process? I personally am on 20, right? We figured this out because we were comparing. You were on 4. I'm on 20 medications per day, twice a day, and I can't miss. In fact, I have to carry them around with me. So between my security and my wealth manager, but it's a constant reminder. So it's also important, the team that you have around you, to support you. I'm here today because I learned something from my big brother and mentor that really touched my heart. You talk about a soldier for the community, the soldier for America. Reverend Dr. Sharpton, as a young man, I would watch him, and I remember seeing him on television with someone who was very near and dear to me, Mr. Michael Jackson. And I saw Reverend Sharpton working with Michael to get his music rights in order. The list could go on what Reverend Dr. Sharpton does. Can we hear from Dr. Sharpton just one more time? So I was grateful that when Rachel called me when I woke up from the coma, as in Rachel fashion, I'm sure many of you will agree, I get a phone call and Rachel says, do you still have did they take the tubes out of your throat today? I don't know how much, but I guess it was the day that the tubes are taken from my throat. I had a tracheotomy. You know, the list goes on. I don't want to bore you with all the scientific details, but what I do remember is Rachel calling me and saying, LB, Reverend Sharpton is doing a documentary on his life. Can you do the voiceover? With a hole in my throat the size of a quarter? Again, I'm saying this to say it's a blessing to have individuals, amazing individuals around you who support you and who continue to encourage you. It's okay, give it up to Rachel. Our senior advisors who sit to my left here, their own journeys that I've watched, it's just, I'm encouraged, and I find the courage to conquer through watching their journeys as well. I am thankful that you are here today at the National Action Network. But I have to say it properly, the 2025 National Action Network. And where's Dr. Sharpton's daughters, amazing daughters who put this thing together? Where are they, please? Please stand. I just want to make sure I acknowledge you if you're somewhere here. I can't see the lights, okay. Right, they're working. Again, I just want to say thank you. Thank you for the prayers. Thank you for the well wishes on social media and things of that nature. I did not understand that the entire world watched this journey. Then I get a call from Rachel again. I have a letter here for you. It's from Vice President Kamala Harris and the First Gentleman, Doug, wishing you well, speedy recovery, and come see us at the White House when you're able to walk. Compliments of Rachel Noerdlinger. But I say that to say that I am truly grateful to be here today. And thank you for the invitation, Rachel, Reverend Sharpton. Thank you with my amazing, inspiring panel. And I want to leave you with this. Don't let anyone tell you that God is good. No. Chicken is good. God is truly amazing. Let the church say amen.
The Vice Chair of National Action Network, Jennifer Jones Austin.
Good morning, everybody. How blessed I am to be with all of you, to hear our dear brother, Dr. Al Sharpton, right? And we know a little bit about that heartthrob moment. Some of us still feel it. Right? I'm going to tell you a little bit about my but God moment. My but God, but for God, and but for our community moment. It was in 2009, September 2009, that after having served for about 16 years as a lawyer centering on children made vulnerable by our society, having gotten the calling from God to work on behalf of God's most vulnerable children, It was in September 2009 that I woke up one morning, a Friday morning, with a flu-like fever. I took some Tylenol, went to work, and pressed on through. But the Tylenol only held the fever back for a short while. Fever kept breaking through. Came home that Friday, went to bed, kept waking up over the course of the evening throughout the night, completely drenched in my own sweat. My husband, my mother telling me that I needed to go to the hospital, to the ER. Kept saying, nah, I'm good. It's just a flu or something. By that next morning, it wouldn't break. So now I gave in. I went to the hospital. When I got to the hospital, I sat in the ER. Y'all know what that looks like, right? And finally, about 7-8 hours later, they triaged me. They looked me over, and they said I had a run-of-the-mill virus. Told me to take some Advil, go home, and just sleep it off. They never tested my blood. If something's going down with your health and you don't know what's what, make sure they test your blood. They never tested my blood. Okay? I went home, popping Advil. Through Sunday, fever still persisting. Monday, still taking that Advil, believing what the doctors have told me I should do. I wake up in the middle of the afternoon, and things are different. I can't see. All I can make out is white. I am technically blind. I call to my mother who's there with me. She says, come on, we got to go see your doctor. I go to my doctor, my primary. She looks at me, she says, I can't do anything for you. Need you to go to the hospital right now. They took me to what is, at that time, one of the poorest performing hospitals in New York City because it was the closest. The ambulance said, we got to get you to a hospital. They took me to the closest hospital. Fortunately, although one of the poorest performing, it was a trauma hospital. They went to work on me, ran a battery of tests. Now it's Wednesday. They come to me and tell me I have leukemia. I have a blood cancer. Leukemia, blood cancer, means that it will move through your body. They tell me not to worry because with leukemia, if you get chemotherapy, you can go into remission and you can live. You'll be inconvenienced for about 6 weeks or so, but you can live. They then did a biopsy. Kind of chiseled some bone from my backside to determine what kind of leukemia I had, to determine what would be the long-term treatment for me. What kind of chemotherapy cocktail? They learned I had a broken chromosome, which rendered my blood and bone marrow system defunct, no longer operative. They said it was environmentally caused. I was in 9/11. I'll tell you, I prayed to God when walking the streets of 9/11 with my then 3-year-old daughter, pregnant, 6 months pregnant, that Lord, whatever may be happening, whatever we're breathing in, let it come to me. God answers prayers. You hear me? God answers prayers. The next 10 days have only been told to me because I went into a coma. My body began shutting down. The leukemia, the blood cancer was moving through my body. It was in my lungs. I could no longer breathe. Friday, just 1 week after waking up with a flu-like fever, the doctors told my husband I was going to die. They told him I was going to die in 48 hours. They gave me a 1% chance of survival. But here's what happened. The community went to work. The community began praying for me. And God said, not right now. I got a chemotherapy cocktail and it worked, and I came through. And when I came through, what I learned when I woke up from that coma was that the blood cancer, again, had rendered my bone marrow system defunct, no longer operative. I needed a bone marrow transplant. I needed someone with a good blood and bone marrow system to give me some of their good blood and bone marrow. The doctor said, you need a transplant from someone of similar genetic typing. They said not to worry. You know, you'll have 3 full-blooded sisters and brother. 2 sisters and brother, same mom, same dad, you'll get a donor from one of them. They were tested. They matched each other. They did not match me. They used to tell me I was adopted. I look a lot like my daddy and a lot like my mother, as Bishop Taylor can attest. But they didn't match me. They matched each other, but they didn't match me. We turned to the bone marrow registry, National Bone Marrow Registry. 8 million people in that registry. Not one match for me. My husband said, what should we do? Should we do bone marrow drives? The doctors told him not to waste his time, just to let me live out my days in peace. But that man loves me and he likes me, and he said, we're gonna try. So he turned to the community because it's needed someone similar genetic typing, someone of the same race. I'm a proud African American woman. We turned to the community, and they conducted bone marrow registries. The House of Justice came together it was November 2009, people swabbing to see if they were a match for me. Now here's what happened. My husband, Commander-in-Chief, stood up donor drives across the country. More than 200 drives held in less than 13 weeks. More than 13,000 people who did not know me, signed up to be a potential donor for me. 13 weeks, 13,000 people. Not one person matched me. But here's the blessing. Community taking care of community. There weren't enough of us in the registry. We don't show up in that registry. And when we do, because of, if you will, I'll clean it up, the diluting of our bloodline. Come on now, slavery, the raping of our women, the diluting of our bloodline. When we are in the registry, it's not easy to find a match. So there was no match for me. But when those 13,000 people came forward, what started happening was people who were in need of bone marrow transplants, people like me, people like you, started getting them. To date, more than 130 people have received bone marrow transplants from people of color for other people of color. I never got a bone marrow transplant, but God had something else for me. On February 24th, my new birthday, God provided stem cells in cord bloods of 2 African American baby boys to be donors for me. Now, when I tell people about that, I have to testify, because it was in law school when God spoke to me and said, I want you to take care of my children who've been made vulnerable. And when I needed someone to take care of me, my siblings couldn't help. The doctors alone couldn't do it. 8 million people who were in that registry couldn't do it. 13,000 people who came forward, but those little black boys whose mothers gave birth to them in public hospitals, they were there to take care of me. Community taking care of community.
Well, woo. You know, many of you know our beloved Jennifer because she is the vice chair of NAN, and her lineage runs deep. Her father was a top lieutenant of Dr. Martin Luther King Jr., and her father introduced our leader, Reverend Dr. Al Sharpton, to civil rights and into this path that he is leading today. So she just gave a bit of her soul. Woo! I hope you could follow that, Councilman Brannan. Without further ado, I'd like to introduce someone that is a friend to NAN. He has been fighting for the rights of New Yorkers across a whole wide array of issues for a very long time. And he is a current council member, Justin Brannan, and he himself received a transplant. And so he's going to share a bit of his story as well today, and then we'll get into a discussion. And we're about to be joined by the musical rap artist Freeway. So, Councilman Brannan.
You're going to put me up here after Jennifer Jones-Austin. Thank you, Nan. It's great to be here with you today. I'm Councilman Justin Brannan. I represent Southern Brooklyn in the City Council. Anybody from Coney Island here? All right. We're always in every room, right? It's great to be here today to share our stories, to make people feel like they're not alone. I never wore glasses for about 30 years. I'm 48 now. All of a sudden, I started losing sight in my left eye. Didn't understand what it was. Went to the doctor, went to a couple of doctors. They tried to prescribe me different kinds of glasses. It wasn't working. Finally, I found a doctor. I was lucky to find a doctor who diagnosed me with something called keratoconus. I said, what? He said, keratoconus. I said, okay. It's something that over time, your eye starts becoming like the shape of a cone, and you basically start going blind. And of course, me being a tough guy from Brooklyn, I ignored the symptoms, which is something we should never, ever do. I ignored it for too long. And by the time I got myself to the doctor's office, they said the only thing left to do here is to get you a cornea transplant. I couldn't believe that this is where I was. And I was lucky enough to receive a cornea transplant, and it saved my vision and it saved my life. And now, in this moment, I think certainly in this country, policymakers, politicians, this is a moment when we can no longer sit on our hands. We can't sit on the sidelines. And you have to turn your lived experience into change, because it shouldn't have to happen to me for it to matter to me, right? But this did happen to me. And the first thing I thought of was, what about the people who don't have the connections or the health care that I have? What about the people that can't afford to get an eye exam? What about the people that don't have access to these doctors? That's why I always believe, look, if you have more money than me, then help yourself to a nicer car and a nicer house. But our health care should be the same. Because just because you have more money than me doesn't mean that your life is more important than mine. Our health care should be the same. You got tons of money, get yourself a mansion, get yourself a couple of cars. God bless, enjoy. Go to the nicest restaurants. But when you get sick, you should see the same doctor as the poor people see. So I'm really happy to be here today because I want to talk about, when you get into the panel, to talk about how we turn our lived experience into policy and how our zip code should not determine our outcome, right? The fact that in New York City, life expectancy can vary by 10 to 12 years depending on what zip code you live in. That's not biology, that's inequality. That's inequity. That's lack of investment. That some neighborhoods do better than others. And last thing I'll say is COVID. No one wants to talk about COVID anymore, right? But you know what COVID showed us? It was low tide. It exposed inequity that's been hidden in plain sight. That some neighborhoods are doing better than others. Some neighborhoods have access to care that other neighborhoods don't have.
That's right.
And that's why I never say these neighborhoods are not underserved, they're under-resourced. They don't get the resources they need, and it all comes back to our health and taking care of each other. So thank you for having me today. God bless you.
So we have now been joined by a young man that is a very powerful lyricist and has been in the music industry making really good music for a long time. But along his journey, he too had to get a transplant. And he received a kidney transplant. You know, as Al B and I have been crisscrossing the country as the co-founders of the Health Equity and Transplantation Coalition, we have been working with kidney transplant doctors and kidney specialists across the country. And we've really heard some powerful stories about the plight that folks have gone through. So without further ado, I'd love to bring to the mic Freeway. He's familiar with this mic. Please tell us a little bit about what you went through, sir, and your struggle, and then we'll get right into a few questions. Thank you.
Good morning, everyone. How's everybody feeling today? My name is Leslie Pridgeon Jr. I'm publicly known as Philadelphia Freeway. I'm a recording artist. I was part of one of the best record labels ever, Rockefeller Records. How many of y'all familiar with Rockefeller Records? Yeah, so I started my music career probably like in the early 2000s. I was on a crazy album called The Dynasty. I had a verse on a record called 1-900 Hustler. and it changed my life, which was a huge blessing to me. I was able to maintain an amazing career, and that leads us to early 2015. Early that year, I started feeling weaker than normal. I would just get tired out of nowhere, get tired for no reason. It came to a point where I got tired just walking to the car, so I knew something was wrong. I was going back and forth to the doctors trying to figure out what happened, what the issue was. We had a big concert in September 2015 called Made in America in Philadelphia, and this is the first time I had this experience. I had to perform. I looked out into the crowd, and I had like an anxiety attack. I felt like I couldn't perform. So the next day, I went to the doctors. I got blood work done. A few days later, the doctor called me and told me to get to the emergency room. So me being Muslim, the first thing I did was I went to the masjid. I prayed. I asked God to help me deal with the situation, whatever the situation is. I went to the hospital. I was diagnosed with end-stage renal failure. They cut my chest open, they put a permacath in my chest, and the next day I started doing dialysis. I did dialysis 3 times a week, 4 hours a day from September 16th, 2015, all the way to February 5th, 2019, when I received my gift of life. I received my new kidney. When I was first diagnosed with kidney failure, it was people around me like, we can't let nobody know what's going on, it's gonna make you look weak, and all those type of things. But me and my team decided to stand in front of it. I started a foundation. Thank you. I started a foundation called Freedom Thinkers Academy, which is music, health, education, and culture. I travel the world spreading awareness. We preach prevention so people don't get to the situation where I was at when I needed to get a new kidney. So Freedom Thinkers Academy is music, health, education, and culture. That's what we do on the health side. On the education side, in Philadelphia and in Delaware, we have some STEM workforce development programs. We have phlebotomy, medical billing and coding, medical tech, audio visual engineering. And to this date, we graduated 154 students through the grace of God. I was running around with 3 of the leading risk factors for kidney failure, one being hypertension, another one being diabetes, and surprisingly, just being African American is a risk factor. So I had 3 risk factors. I had examples in my family. My cousin Shandia, she passed away early because she wasn't taking care of her kidney. She left a couple kids behind. My Uncle Chucky got put on dialysis. He got a transplant. Then he went back on dialysis. And then in 2022, he had an accident on his way coming from dialysis, and he passed away. So I had examples in my family. I had 3 risk factors, and I still was unaware that it could happen to me. So I felt like it was important for me to let people know what's going on. In the words of the great G.I. Joe, knowing is half the battle. So that's been my mission since, I was diagnosed with kidney failure. I'm gonna bring y'all to 2020. It's crazy, man, because, in Islam, they say with every difficulty comes relief. I had a difficult 4 years, and then through the grace of God, I received my transplant. I received my gift of life. And going through those things, like having surgery and, the whole experience prepared me for what I was about to go through that I had no clue I was about to go through. In September of 2020, my daughter was diagnosed with a rare cancer called sarcoma. In October of 2020, my son passed away. As soon as we buried my son, we went right back to fighting. Me and my daughter, we fighting back and forth to the doctors. She had to get a surgery on her back. They told her she wasn't going to walk again. She started walking again. Alhamdulillah, she was doing good. This cancer that she had, no one survived it. But of course, we was hopeful. They would tell us stories like, yeah, some people last 15 years. So we were hoping for the best, but she had tumors everywhere. The next year, October 2021, my daughter passed away. And then November of 2022, my father passed away. He was dealing with dementia. And we all lived together. So when I went home, it was just me after all that, which was, it was rough. It took me a minute to even be comfortable just being in a house by myself. You know, sometimes I would sit in the car till the sun come up, even though I know it sounds like when I said hustle till the sun come up, but I did used to sit in the car till the sun come up sometimes, man. You know, and it's very, 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 very rough experience, but I believe the main thing that got me through is my relationship with God. I had a relationship with God before any of those things happened to me. You know, I was praying 5 times a day. I had a relationship with God, so I was able to lean on that relationship. You know, and the most important thing to me today, present day, is spreading awareness and, you know, just trying to enlighten people so they don't go through the things that I go through, or if they have to go through them, they be more prepared dealing with those situations. You know, so when I got the call and they asked me to be here, it was a no-brainer. You know, I'll be sure, of course, you know, I'm a huge fan. You know, I got a lot of love for you. I seen your struggles and what you've been going through, and I got your back 100%, bro. You know, and I know we're here for equality, health equality, and that's very, very important. You know, medicine, like when I was in 2009, I was diagnosed with high blood pressure and diabetes. I didn't have any insurance. I was paying like $1,000 a month out of my pocket just for medicine, which was crazy. And I was able to do it because I'm a rap star. But, you know, if I wasn't in that position, and there's so many other Americans that's not in a position that can't afford those things, you know. So it's important that we get treated equally when we go see these doctors, when we gotta pay for these medicines. I'm from the hood, and a lot of, like, back in the day, we could share, like, we used to share each other's medical cards back in the day. You get your own, like, yo, you gotta go to the doctor, let me get your medical card. But, you know, technology, you know, has risen so much since then, so we can't do that no more. And where I'm from, I'll give you a perfect example. So it's a section, I'm not gonna take up too much more of your time. It's a section in Philadelphia called Kensington. They call it Kensington Beach. That's where, like, a lot of the addicts and stuff live at. So I was talking to a friend of mine when COVID was happening, and they was like, listen, like, COVID is everywhere except Kensington. There's no numbers in Kensington. I'm like, yeah, that's because ain't nobody in Kensington going to the doctor. Nobody is going to get checked for COVID because they don't even have medical insurance, so they can't even go to the doctor to get checked for COVID, you know. So that's the reality of the inner city. A lot of people in the hood don't even go to the doctor because they can't even afford to go to the doctor, or they don't have insurance. So together, collectively, we got to come together. We got to do better. I'm Philadelphia Freeway. I'm here with y'all.
Thank you, thank you. Can you hear me? Is this on? Can you guys hear me okay? Woo. So one thing about this panel is folks do not look like what they have been through. My. So we're going to just take a few minutes just to think about a couple of different questions that are extremely important at this juncture of where we are in American history. And where we are is at an inflection point where they are trying to take away everything we have. And so it is up to us, the good people in this room and the folks on this panel, to strategize and galvanize people around solutions and action items. So the first thing I would present to Jennifer Jones-Austin. If you could just talk, Jennifer, one of her many jobs, she is the CEO of one of the most important and powerful poverty-fighting institutions in New York and possibly the country. And so she gets wonky. You know, she looks beautiful and sexy, but she's also real wonky. And so she's going to talk a little bit, if you could, Jennifer, what are some of the clinical barriers to access to health care? And in the wake of them trying to take away Medicare and Medicaid, what do we do if we don't have this access?
So first and foremost, well, I like that I look good. I don't feel good all the time that I look good, so I'll take that from my sister who's always fabulous. I thank you for that. Thanks for loving into me. One of the things that I appreciated when I was sick, you know, I was really helped to understand this through my family, through friends, and extended, you know, community, was that you're nothing without your health, right? If you do not have good health, then you really can't make it, right? You can't get out of bed, you can't think straight. You know, your costs, healthcare costs can take away from your family. And what I appreciate is that very much like they are trying to take away, or they've never really lived into, equal education for people of color, especially black people, the same holds true for our health care. You know, with the possibility of the further erosion of critical healthcare funding such as Medicaid, I said to my daughter, who's a healthcare policy analyst, I said to her, well, what are they trying to do? It's like they're trying to kill us. And she looked at me, she said, they are. They are, right? The minority becoming the majority is a real concern. So how do you push back on the minority becoming the majority? You create fewer, or you allow for lesser and lesser people continuing to live and live well. You're nothing without health, education, and income. Economic security in America is only achieved when you are able to take good care of yourself in terms of going to job, but also having the health care and the funding that allows you to be engaged. And here in America, even with the Affordable Care Act, the Obamacare, as they like to refer to it, even though they like it, they like to trash Obamacare, but they love Affordable Care Act, right? Even with the Affordable Care Act, black Americans still go without affordable health care. You may have the basics, but that basics doesn't necessarily allow you to go to the specialist doctors you need to see if they're out of network. A lot of out-of-pocket incidental costs are not covered by your health insurance, by Medicaid, by Medicare. That is, frankly, when it comes to healthcare, the biggest barrier. When I had my transplant, are you all ready for this? It was in 2010. That transplant, in the moment, and in the days and the weeks and the months that followed, cost us over $1.9 million. Now, thank God we had good health insurance. We didn't have complete coverage, but we had good health insurance that took care of maybe about 1.65 million. What does that translate to? Trying to figure out how we're going to make up the difference. About 250K.
Wow.
What is happening in America when black Americans still suffer from wage disparity and inequity, when we still have structurally created deprivation in the form of inability to grow wealth and assets? When we get sick, even if we have health insurance, it doesn't cover the costs. The biggest barrier we have is access to quality health care that has a price tag on it that we cannot afford. The insurance system needs to be structured differently, as Councilmember Brannan talked about, and that then plays into the interplay between government and the insurance business. Our greatest barrier to quality health care is still unaffordability. When I have to go to the hospital via ambulance, just last year, and I'm in a remote place, I present my health insurance card, and then about 2 months later, I get a bill for $3,700 because I took an ambulance that was considered to be out of network. Our people are not even calling the ambulance because of that. The biggest barrier is our continual economic insecurity, and how healthcare is a big part of that, and lack of quality care, all tied to unaffordability and us not having the resources to make up the difference.
Thank you, Jennifer. You know, one of the themes of National Action Network is turning demonstration into legislation. We are out in these streets and we're in the suites, pushing for legislation around a number of issues. And I have had the blessing of watching Al Sharpton navigate from the streets to the suites in the name of legislation around health care. And you know, just before he almost died, he had a fight March 27th was the anniversary, actually, and he had a massive boxing tournament. And he was in the ring, and he literally annihilated his opponent. Flew him, I was there, the guy flew across the ring. And I remember looking at him that day and thinking to myself, my God, this man is really a fighter. And he stood that since the day that he woke up from his coma. He has been fighting in the same way that he fought that day in the ring. And so I cherish my partner. And if you would, Al, can you tell us a little bit about the legislation that you were the author of, the joint author in Texas?
Thank you, Ms. Rachel. So I guess I'm supposed to properly introduce myself in this moment. My name is Al B. Shore. I am the executive chairman of the Health Equity and Transplantation Coalition, and I am flanked by royalty. My senior advisors, my co-founder, the legendary Freeway. Man, I've driven down that turnpike to go see y'all so many times. I love Philly. You already know, 215 affiliated.
Yes, sir.
Yes, sir. I, too, was faced with this monumental task of a bill somewhere south of $4 million. I'm embarrassed to say that for many years, I'm now 56, and for many years I didn't know much about insurance and things of that nature. To find out that I had some of the greatest insurance available. So Jennifer made such a great point in terms of the education and understanding how to navigate. I think one of the issues in the community is that we don't know how to navigate the system. Because some of it's available, but the healthcare system is in bad need of a software update. Because we must create equal access to quality health care for us all. Just like he was saying earlier that it shouldn't matter your area code, your zip code, your tax bracket. We should definitely have access to quality health care. Rachel and I have been in the halls of Congress. We are elated that we had the participation of state representatives coming across the aisle, because I made it very clear, I'm not here for the politics. I'm simply here to save lives of transplant patients. 50,000 of us were in jeopardy of death per year, I think on average, in terms of the research. And I just could not lay there. Our other queen here, Jennifer Jones-Austin, made a very significant point. Ms. Rachel, you said that we don't look like what we've been through. And you're right, very specifically because I wanted to make sure that I didn't operate in this new capacity with anyone feeling sorry for me. But yes, there are many mornings where I wake up in the fetal position, not able to move. I know you may see me online and you hear about all the circus out here, which has nothing to do with my life. I'm a quiet gentleman who likes to read. I live in the woods and I do homework with my grandson via FaceTime. But back to the focus is, I've been elated to now be the co-author of legislation in the state of Texas for transplant. We are officially in the books. We were recognized on the Senate floor a few weeks ago. Of course, Rachel by my side. I so appreciate your guidance. You know, as much as I don't even want to say that I'd like to take credit. Y'all know it's Rachel. Right, Jennifer?
Amen.
Amen. Let the church say amen. You know, I say that, you know, with a smile, because it's great to have one of the most powerful women on planet Earth in media, the world strategist, to guide you in this very difficult system. because very specifically, I'm not into the politics, as I said. But I've been asked recently to consider running for office. This is not an official announcement. Let me make that clear. Because of course I would have to discuss this with Reverend Dr. Sharpton before I do any of this. So forgive me, Reverend, for mentioning it. But yeah, we're going to keep hope alive, absolutely. And we're going to keep it New Jack Swing. No, but listen, it's very important. And the last point I want to make, part of this, again, I said this is the education. The education is very important. We're going to keep this together right now in this moment. So, I have a mother, 5'2", Mike Tyson. Any mothers in the building who got to take care of these kids out in these streets? So you know what I mean. Well, my 5'2" Mike Tyson mother is currently in hospice care right now. No, she's still Mike Tyson. I walk in the room, stand over there, open the window, sit down, stand up. Just want to make sure you're still functioning. While I was in the coma, not knowing that my mother's cancer had metastasized, and for those of you who don't know what that means, it's basically spread all over. I think Jennifer explained that earlier. But she sat in a chair in front of my door while I was in a coma and made sure to keep TMZ and different people, away so that I could heal properly and things of that nature. But things that a mother would do, you just have no idea the strength. While she had 2 fractures in her spine, I mean, the list goes on. So I wanted to stop and just say thank you to my mother. All praise due to the Most High. And learning in this process of Medicare and Medicaid and the coverage, because at one point, because it's my mother, I was paying close to $40,000 per month for her care, 24 hours.
Wow.
Because she wasn't functioning. And I won't mention the insurance company because I don't want to be more in the media, but some insurance companies will designate that you are able to be discharged from a hospital without seeing you, only from reading a chart. So when I had to go pick up my mother, take her home, and carry her to the restroom, that's not good. My mother's dignity is everything to me. So I wanted to make sure that, we went through the education. I called Rachel, we discussed how do we get the information, and we proceeded to find ways to make sure that she had Medicaid and the coverage that would cover her care, and people recognize, and I'm just grateful. I'm grateful for you, and I'm grateful for everyone here on the panel, just for your dedication to fight and advocate for equal access for the community, for quality health care right here in America. Thank you.
Thank you, Albie. Councilman Brannan, could you just spend a moment talking about, you're on the inside. You understand how to navigate these laws. And I guess my question to you on a sort of a regional level as it relates to New York, but nationally as well, because a lot of the delegates here are from around the entire country. What is the work we need to be doing for us right now when many of us feel like we may wake up and not have health care at all? What can we be doing?
Thank you, Rachel. That's a great question. I think in this moment, we got to do 2 things. We have to continue turning our lived experience into actual policy. That I often say that the best ideas for a law or for a change in policy come from someone coming into your office and saying there ought to be a law, because that's how you're listening to the people. And politicians in this moment need to be listening more and talking less. But with the threat of funding cuts from the federal government, politicians in this moment also have to use their privilege of power to stand in the breach between the federal government and our most vulnerable, who are going to be most impacted by the cruelty and chaos that's coming from Washington. So local governments now are going to really be on the front lines. And I say this as a local politician, you all should be demanding more of your local elected officials in this moment. And what the city council is doing under the leadership of Speaker Adrienne Adams, the first black woman speaker of the city council, the first grandmother serving as speaker of the city council, so you know how she sees the world. We're doing everything we can with a $115 billion budget in the city. How many people feel like they live in a city with a $115 billion budget? I didn't think so, right? No one ever raises their hand. We shouldn't be struggling so hard in a city with a budget that big. And it comes down to how do we spend that money. And I have some notes of what the city council's been trying to do. And from my own lived experience, when I dealt with getting the cornea transplant, I immediately then passed a bill to provide eye care and eye exams for low-income New Yorkers who were just not getting their eyes checked because they couldn't afford the exam. And so those are ways that you can turn lived experience into policy. The city council cares very much about maternal health equity, especially in black and brown communities. We funded over $3 million every year toward maternal health programs aimed at black and brown women. We have a citywide doula initiative. We have a By My Side birth program that offers community-based doula services in Brooklyn with real results. It lowers C-section rates, better birth outcomes. We're focused very much on maternal health equity and going back to that zip code thing, where depending on where you live, your outcomes are very different. And we should not live in a city like that where some neighborhoods get the full loaf of bread and the rest of us have to fight over crumbs. Not when it comes to our health care, right? So I think to sum up, to answer Rachel's question, I think we have to always center on the fact that just because you and I might get different paychecks, it doesn't mean that our health care should be different. But the city, even in the face of inaction or worse in the federal level, we've got to be doing our share. We can't sit on our hands. We've got a colossal budget that we can use to actually change outcomes for New Yorkers, and that's what this moment calls for.
Thank you, Councilman.
Rachel, can I just quickly add to that? You know, in addition to the work that can be done by the city, we also need to look to the state. And for several years, there has been a proposal, a bill that has been at the state level, providing Medicare for everybody, a single-payer health care system. The bill is called the New York Health Act. And it has stalled. And essentially what it aims to do is to ensure that every New Yorker would have quality health care insurance. Now, the challenge to it is that essentially you have commercial health care insurance companies who don't like it, right? And so what they do is they then lobby the senators and the assembly persons and tell them, no, this would not be good for us. It very well may be good for the people of New York, but it wouldn't be good for us. So what I'm imploring you all to do is to think about, just as the commercial healthcare providers, the healthcare insurance companies are lobbying the state legislators, you too should be lobbying, lifting your voices to say, we need universal healthcare insurance for everybody in New York State, especially if they're going to play with us and try to further erode our Affordable Care Act, our Medicare, and our Medicaid at the federal level. We've got to press at the state level.
Oh, amen goes right there. Philadelphia Freeway, sir. You know, one of the things that we're in this new era where everybody's getting their information so differently, much of it on the internet and digitally. And you know, back in the day, we'd be out in the streets passing out flyers when we had needs and concerts and getting outside. But we're in this era where people are just kind of consuming everything they see. And what has been really joyful to watch about what you're doing is you've been able to galvanize a lot of young folks around your work. And I guess my question to you is like, how are you you've become the messenger, not just for music now, but for this very important issue. And I guess my question to you is, how do we keep young people excited about issues that are really going to decide our survival?
We got to meet the young folks where they're at, We got to go to the places they're at, We can't be afraid to engage with them. We got to talk to them. We got to listen to them more importantly, And I just tell them the truth. Like, I don't hold no punches. I keep it real with them. I try to encourage them to do better. When I started this journey, when I was diagnosed with end-stage renal failure, one thing that I knew my fans knew that I stood on the truth, and I tell the truth.
Amen.
And that's valuable. So when I'm giving them this information, it's the truth, it's from the heart, and it's something that I've been through. Like, I do events like this all the time. Sometimes it'll be me on stage with like 4 doctors. I don't have a doctorate at all, but I have real life experience, and that's valuable. So we just got to meet the young folks where they're at. We got to keep it real with them. We got to listen to them. We got to engage them, and we got to let them know, listen, when we're gone, this is y'all. And if y'all don't get it, if y'all don't help us get it together, it's not going to be together for y'all. So that's my mission.
So as we start to wind down and close out a little bit, Al B. Sure would like to speak.
I wanted to acknowledge someone who's very special. As you know, where am I from?
Mount Vernon.
Money earning. I happen to see someone who is one of my favorite people in the world, in addition to my childhood friend from Mount Vernon High School, who is the amazing current mayor of Money Earning Mount Vernon. Mayor Sean Patterson Howard, can you please stand? We want to acknowledge you. So good to see you. I know how busy your calendar is, so you being here is an honor, so we appreciate you being here. Thank you, Mayor.
So as we start to close out a little bit, I would just ask each of our esteemed panelists to just, give us a few words of hope, give us some, the theme of this convention is being a light in dark times. And certainly everybody sitting up here is that light in dark times. And all of you are that light in dark times because you took the time to be here today and to hear about something that, by the way, isn't the sexiest issue. We've been trying to figure out how do we make health equity sexy? Well, it's sexy, all right. So if we could just close out, each of us, I guess we'll go back to Justin and then just go down. If you guys could just say a few closing words, inspire us a little bit about, the fight ahead and how do we stay motivated and energized.
Thank you, Rachel, and thank you, Nan, for putting on this important panel today. I think this is the most important issue of our time right now. I think certainly as we're all living longer, but at the same time, the cost of health care is getting higher and higher with hospitalization and prescription drugs. We're on a very, very dangerous road here. And we're still seeing that inequity. And like I said before, during the pandemic, I think that's when people who maybe were blind to it or didn't want to see it, that's when they woke up to it, when they saw how different zip codes were determining health outcomes. And I think to what Jennifer said, I think you have to demand more of your elected leaders, right? We ask for your vote, and it's our job to make your life better, right? I wake up every day and say to myself, how can I make life better for working people in this city? That needs to be your focus, and health is wealth. And if you can't afford health care, you don't have access to health care, culturally competent access to health care, it changes your whole life. When I got my cornea transplant, it didn't just save my vision, it saved my life. And I think by demanding more of your politicians in this moment, when they're listening, and the politicians need the people right now more than the people need the politicians. So you need to speak up, demand more of your leaders, and push for systemic change, because until we get this right, we should not be patting ourselves on the back.
You said a word. I want you all to remember that, first and foremost, you are your greatest healthcare advocates. And that begins with taking care of self. For so long, we've been told as a people that we are not worthy, that we should be comfortable with the crumbs that fall on the floor. And that's how they treat healthcare in America for us. But we are indeed worthy, and we need to start moving and shifting our own mindsets from accepting less than what is fair, what is right, and what is equitable. Do you hear me? It's not just what they give to us, but what we demand for ourselves and what we believe we should have. And so first and foremost, you've got to recenter your mind if you think otherwise, that less is good enough. Less is not good enough. The fight that we're in is going to require that we be as strong as we possibly can be. We've talked a lot about physical health care. We've also got to take care of our minds, our mental and our emotional well-being. When I got sick, and let me just quickly share this, it's not something I often talk about. I had a very stressful life. I had a very stressful job. I thought I was handling the business. I would shower in the morning, wash my hair, and there'd be clumps of hair in the drain. I was 40 years old, and I had acne on my face, and I was like, is this midlife acne? What is this? It was stress finding its way to manifest. But I ignored it. Cancerous cells live in everybody's body. It is when your immune system is compromised, and stress can compromise your immune system, that those cancerous cells can become powerful and can overtake the systems that work against them. So I want you all to remember you deserve more. You are worthy. You don't deserve the crumbs. We deserve quality health care. We're not going to let you tear us down and break us down to think that we should be okay with just enough. And we're going to step up and engage and fight for quality health care for every single one of us.
Why don't we let Philadelphia Freeway, and then Al, you can close this out.
Okay.
Health is wealth.
Yes.
At my worst point, I would have traded everything, the fame, the money, the cars, the jewelry, everything, just to be healthy. It's so important. It's the most important thing that we have besides time, health and time. If we don't fight for ourselves, nobody is going to fight for us. They not just going to hand it to us. We got to fight for it. So listen, y'all know what our mission is. Let's go out and do it.
Thank you.
To emphasize the lyrical genius to my left, health is not the new wealth, it is wealth. Even to the point where I am elated that at times, very specifically when we're addressing these health issues around America, I travel with two very important gentlemen who serve very important, just meaningful positions in my life. Of course, the gentleman over here, Mr. Thomas, who is the head of my security who travels, he's also a firefighter as well. So we want to give it up to all the firefighters very specifically. We know what they do. In addition to Mr. J.D. Garnier, the senior wealth manager at Merrill Lynch. And what the purpose of me mentioning both of the gentlemen is that I am in a constant education all day long surrounding entertainment, whether it's, Freeway would understand this, retaining my master recordings, my publishing. As you know from the intellectual property law in 1978, my time is here, so I did all the proper paperwork to submit to the Copyright Office that I was going to exercise my right to gain all of my IP.
That's a blessing. We got to clap for that. That's a blessing.
So we're in the process of doing that, but also as an entertainer, as you know, from being signed to different labels. I was signed to Warner Brothers. I'm still, for 37 years. In the interim, I was also, this is some history that you may not know, I was also signed to Death Row Records. Absolutely. But I'm saying that to say that I'm one of the only artists, and I'm sure the gentleman to my left, I have retained every contract that I've ever done, whether it's Jodeci, Usher, Al B. Shore, any production, 112, any productions I've ever done. And it was very helpful in these days and times as I'm going back to these labels. And we do something called Legacy Artist Advocates, which is helping the artists to find these unpaid royalties. So my wealth manager here has been instrumental in setting up everything from trust to will and testament, everything. And it's been such an education. I'm like, wow. And I'm almost embarrassed at 56 years old and blessed that I woke up from a coma to get this in order, because if you notice, when you see some of your favorite personalities pass away, the entire family is in disarray. And it'll be determined by the state about where your assets go. These are the things that I want to always share with someone very near and dear to me. This strong young father named Kari Noerdlinger. Let's give it up to Kari Noerdlinger, who's an incredible artist himself, but one of the greatest fathers I've ever seen as a young man, who will not let that young man move without his eagle eyes on that young man, from doing homework to just making sure. One of the greatest fathers. I'm so proud of you, young man. Keep doing what you're doing and being an example to the community. You already know. And again, I want to say just thank you to everyone here. I want to thank you to everyone who's ever, I was going to say the wrong thing, Freeway. Look at the audience. I was going to say stream. Whoever bought some vinyl, whoever had an album, I so appreciate you for allowing my art to be any a part of your journey along the way, whether it was childbirth, finals, divorce, breakup to makeup, or just some of that good old, never mind.
So,
Blessings to everyone. I appreciate you being here. Thank you for supporting NAN, Reverend Dr. Sharpton, the National Action Network, and please continue. Make sure you visit, you know what I have to do too? To follow the journey, because these are the most important people in my life here. Follow us, because my kids will be like, Dad, you didn't say social media. Please follow us on social media, which is at Transplants, like plural, Transplants, the number 4. You can take out your phones right now. Transplants, the number 4, all. Transplants for all. And follow us around the country as we navigate the halls of Congress, fighting for your healthcare requirements. Let's go.
So we're going to
Make sure y'all follow me too, at Philly Freeway. Right now, thank you.
Jennifer Jones Austin.
At Jennifer Jones Austin.
and Brannan.
And FPWA. At FPWA.
What's your handle, Councilman Brannan?
it's just at Justin Brannan.
At Justin Brannan. All right, we gotta keep relevant and in the know, and the way to do so is to follow folks in real time. So Al B. Shore started to talk about something that is actually going to be touched upon a little bit later, so he'll be back on the stage. When he and Reverend Al Sharpton and Ari Melber from MSNBC have a conversation this afternoon at 1:15. If you watch MSNBC, you know that Ari Melber is what they call a hip-hop head. He loves hip-hop. Well, we're going to have a conversation today about hip hop. Al B has been one of the most sampled artists. Outside of, Reverend Sharpton was a protege of James Brown, who was like his surrogate father, who we all know is the most sampled artist
Of all time.
Of all time. So that conversation will happen at 1:15. And then we ask you not to go anywhere because we're going to dive into a very important discussion with some amazing humans led by our Attorney General, Benjamin Crump, and some of the mothers of the movement and family members that Nan has fought tirelessly for. And I see Dominique Sharpton, so we will rise, take our photo, and get together.